Well, hi everybody, I'm Bill Whittle and welcome to the Vortex. You know, there's an ongoing debate in this country concerning the Patient Protection and Affordable Care Act, otherwise known as Obamacare. Liberals love it, conservatives hate it. Now, liberals want to know why we cold-hearted, dark-souled conservatives with our shriveled consciences and sharp, pointy fangs hate the idea of free health care. Well, I recently read the Obamacare Survival Guide. It's the only real guidebook for the new law, a law that totals more than 15,000 pages of rules and regulations. So now for the first time, I really understand how scary this law is. So I sat down and wrote 5 reasons why we cold-hearted, dark-souled conservatives with our shriveled consciences and our sharp, pointy fangs hate the idea of free health care. Well, first, we hate free health care because health care isn't free. Healthcare is in fact expensive. Even what used to be relatively cheap healthcare now costs a lot of money. You know, it used to be you could go to a doctor with a sprained ankle. You'd sit on the bed, roll down your sock, he'd take a look and say, yep, that's a sprained ankle, all right. Try to stay off it for a week. That'll be $30. And off you'd go. But now with full coverage and out-of-control lawsuits, he may end up saying, yep, that's a sprained ankle, all right. Better get an MRI just to be sure. Now it's a $1,000 visit. Used to be someone had to pay the doctor. Now someone has to pay the doctor and the office manager to fill out the forms and the insurance company and all of their employees and the MRI operator, the MRI manufacturer, the hospital staff where the MRI is located, and the electric company. Somebody has to pay for it. That's not a right. That's a commodity. So conservatives hate free health care because there's no such thing as free health care. There's only prepaid health care. Now, second, conservatives hate free health care because health care isn't free and because Obamacare gets the government involved in your health care. Up until now, most Americans only dealt directly with their government in 3 places: the post office, the passport office, and the DMV. How have those experiences worked out for you? Enjoy them, do you? Or are they horrible, frustrating, soul-destroying wastes of your time? Government employees do not get performance bonuses. They don't work for tips. They don't get paid by the customer. They get paid by the hour. So 200 people an hour, 20, 2, they don't care. And government employees can virtually never get fired, no matter how inefficient or surly. In fact, the oddly misplaced, hardworking, and efficient hero who takes a government job by accident is pretty soon smacked back down by his co-workers and his supervisors because he's making the rest of them look bad. So, we hate the idea of going to the DMV to get our children a kidney transplant. Now, third, we conservatives hate free healthcare because healthcare isn't free, because we don't want to beg the DMV for a kidney transplant for our child, and because of death panels. Now, we get mocked for this term, death panels, because the term death panels does not, and I'm shocked to say this, shocked, appear in the legislation. What is mentioned in the legislation are things like resource allocation boards, where limited money means limited treatment. Limited treatment means things like denial of hip replacements for old people, since those limited resources could be used more efficiently somewhere else. You know, it's cheaper to hand out pain pills than it is to replace a hip on an 80-year-old. Older people are also routinely denied expensive but potentially life-saving treatment. Instead, they're given pain pills so they can die at home painlessly and cheaply. Kind of ironic, isn't it, by the way? Liberals accuse conservatives of wanting to push grandma off a cliff in a wheelchair when we're the ones arguing for the private health care that gets her a hip replacement so she can do the smart and sensible thing, and that is get up from the wheelchair and run from the government just as fast as she can. And in Great Britain, for example, we see every year horror stories of people for days lying in their own urine and filth, drinking water from flower vases, because the overworked and underpaid National Health Service has had to comply with mandatory government budget cuts by saving money, by limiting resources that ends up killing people. Now, you can call it the Sunshine Unicorn Universal Happiness Loving and Sharing Brotherhood Committee if you want to, but it's still a death panel. Fourth, we conservatives hate free healthcare because healthcare isn't free, because we don't want to beg the DMV for a kidney transplant for a child, because death panels are a horror, and because of political tyranny. You know, people are already told that if they don't vote Democrat, their grandparents will die because Republicans say we can't print money forever for Social Security and Medicare. We say that because it's true. Now, if we were simple-minded enough to think that we could print all the money we wanted without runaway inflation that makes existing money worth less, then we'd be liberals. If the government can scare people into voting for them by threatening to cut off their retirement money tomorrow, well, just you wait and see how much they can scare them by threatening to cut off their diabetes medication today. Do you really want them to have literally life or death control over your lives? We mean-spirited conservatives don't. And the final reason we conservatives hate free healthcare is because healthcare isn't free, because we hate the idea of begging the DMV for a kidney transplant for our child, because death panels are a horror, because tyranny sucks, and finally, mind your own business. I mean, if you think about it, the best place to live is a place where people mind their own business and no one tells anyone else what to do. Back up, step off, get out of my face. That's the American way. So, if you weigh 800 pounds and want to ride a 6-cylinder BMW K1600 GT motorcycle with 129 foot-pounds of torque without a helmet while smoking an unfiltered cigarette in one hand and eating a bacon-covered donut in the other, then that is none of my damn business, so long as you are paying for your own health care. In that case, I just don't care. But when I am paying for your health care, then it becomes my business, and everyone else's too. So if you like to ride or fly or skydive or skateboard or go off-road or drink a 16-ounce drink or have a taste for cheeseburgers or smoke or in fact like to leave your apartment or house every now and then, don't worry. Sooner or later, someone from the Federal Risk Police will be there to ensure that the free health care costs as little as possible by knowing what's best for you high-risk types. They know better than you do, and they will lovingly and caringly make you do it by loving and caring force. It's happening already, and they're just getting started. Pick up a copy of the Obamacare Survival Guide. It's the best book written about the new law. Whether you're a privately insured person or on Medicare, small business owner, a medical professional, or just a concerned citizen of this great nation, it shows you how to survive Obamacare and beat it. Already, 250,000 people have purchased the Obamacare Survival Guide. It's already a New York Times bestseller at #1 on Amazon. Now, you can get it in any bookstore or online, or you can check out the special offer for just $4.95 by going to Obamacare911.com. I'm Bill Whittle. We'll see you next time on The Vortex.